Welcome to the 11th video in a series which looks at the spread of the COVID-19 virus throughout the world. In this video we provide a comparison of COVID-19 in United Kingdom, home nations, Republic of Ireland, New Zealand and Australian states and territories. In providing an analysis of the performance of all the countries in this video, we firstly need to look at the timeline for each country and the decisions taken by the governments in each country to measure the effectiveness of the decisions-making process and whether or not they have made the impact that was desired by these governments. The first timeline is the World Health Organization. The World Health Organization is an arm of the United Nations, established in 1948. It has a broad mandate advocating for universal healthcare, monitoring public health risks, coordinating responses to health emergencies, promoting health and well-being. Member states are all members of the United Nations. It has a budget of just under $5 billion per annum, and that's mainly through voluntary contributions. The top contributors to the World Health Organization is America, United Nations, Republic of Korea, Australia, the Gates Foundation, Japan, Gavi Alliance, National Philanthropic Trust, United Kingdom, New Zealand, Bloomberg and the European Commission. It has had many successes, mainly around the eradication of smallpox. In December 31st, Wuhan Municipal Health Commission contacted the World Health Organization to report a cluster of cases of pneumonia. On the 1st of January, the World Health Organization set up an incident management support team. On the 6th of January, the WHO published its first outbreak news. And on the same day, it posted on social media reports of a cluster of pneumonia cases in Wuhan. On January the 10th, it issued a technical guidance note. On January the 13th, China shared the genetic sequencing of the COVID-19 to the WHO, who then distributed it across the globe. On January the 14th, the WHO warns of potential for human-to-human transfer. On January the 20th, WHO experts visited Wuhan in China. On January the 30th, the WHO's Emergency Committee declares a public health emergency of international concern. On February the 3rd, the WHO publishes a strategic preparedness and response plans. And on March the 11th, the WHO declared the COVID-19 as a global pandemic. This view looks at the COVID-19 timeline for the Republic of Ireland. On January the 22nd, the Department of Health creates a National Public Health Emergency Team. Then, on February the 5th, they formed the Coronavirus Expert Advisory Group and hold their initial meeting in Dublin. On February the 8th, the Republic of Ireland held a general election. On February the 20th, COVID-19 classified as a notifiable disease. On February the 29th, the first COVID-19 case was identified in Ireland. On March the 12th, all schools were advised to close. Also on March the 12th was the first COVID-19 death in Ireland. On March the 15th, all bars, public houses were ordered to close and individuals advised to avoid house parties. On March the 16th, the government issued a stay at home announced by the government. In this view, we'll look at the COVID-19 timeline for New Zealand. On January the 8th, New Zealand formed the National Health Coordination Centre, and on February the 3rd, all foreign travellers from China were banned. On February 28th, the first COVID-19 case was identified in New Zealand. On March the 16th, New Zealand imposed a limit of 500 persons at public gatherings. On March the 15th, a limit of public gatherings was reduced to 100. On March the 18th, all New Zealand citizens and residents were urged to return back to New Zealand. On March 19th, in conjunction with Australia, New Zealand closes its borders to all non-citizens and residents, and all returnees must self-isolate for 14 days. Also on March 19th, the government raises the alert level to 2, which is reduce. On March the 23rd, all schools were ordered to close. Also on March the 23rd, the government raises the alert level to 3, restrict. On March the 25th, the government raises the alert level to restrict, level 4. And on March the 29th, the first COVID-19 death occurred in New Zealand. Subsequently, on April 27th, New Zealand do intend that they will revert to a level 3 restrict, partially lifting some restrictions. This view looks at the COVID-19 timeline for the United Kingdom. On January 27th, the Foreign Commonwealth advises against travel to the Hubei province in China. On January 28th, the FCO advises all but essential travel to the mainland China. On January 31st, the first case of COVID-19 was detected in England. On February 27th, the first case of COVID-19 was detected in Northern Ireland. A day later, on February 28th, the first case of COVID-19 was detected in Wales. On March the 1st, the first case of COVID-19 was detected in Scotland. And on March the 2nd, the first COBRA meeting by the government was held. On March the 3rd, the UK government published its action plan. On March the 5th, the first death due to COVID-19 in the UK. On March the 9th, the FCO advises against all but essential travel to Italy. And on March the 10th, the UK government allows the Cheltenham Racing Festival to go ahead, which was attended by 150,000 people over a 4-day period. On March the 14th, the UK government herd immunity plan generates controversy amongst scientists. On March the 15th, the FCO issues travel advisories for travel to Spain and United States. Also on March 15th, elderly and at-risk individuals are advised to self-isolate. On March 16th, the PM advises against non-essential travel and going to the pubs and clubs, basically stop enjoying yourself. On March 17th, the FCO advises against all non-essential foreign travel. On March 18th, all schools are closed. On March 20th, the UK government closes all pubs, clubs, except for takeaway food. And on March 23rd, the UK Gov announces a UK-wide lockdown. On April 14th, the UK charities report that older people are being airbrushed out of official figures. This view looks at the COVID-19 timeline for Australia. On January 22nd, DFAT issues an advisory, do not travel to Wuhan. Also on January the 27th, the first case of COVID-19 is detected. On the 1st of February, foreign nationals from mainland China are banned from entry into Australia. Also on February the 1st, all citizens arriving from China must self-isolate for 14 days. On March the 1st, DFAT issues a travel ban to Iran. On March the 5th, the first death due to COVID-19 occurs in Perth, Western Australia. On March the 5th, DFAT issues a travel ban for South Korea. On March the 11th, DFAT issues a further travel ban for Italy. On March 13th, gatherings of more than 500 people are banned. On March the 13th, Australia forms the National Cabinet to manage the COVID-19 outbreak. On March 15th, all arrivals into Australia must self-isolate for 14 days. Also on the March 15th, all cruise ships are banned from docking in Australian ports. On March the 18th, Australia declares a human biosecurity emergency. On March the 19th, Australia closes its borders to all non-citizens and non-residents. On March 21st, Australia implements social distancing rules. On March the 22nd, the federal government orders the closure of all places of social gatherings except for takeaways. Maximum 5 at weddings, maximum 10 at funerals. Also on March the 22nd, state governments impose mandatory closure of all non-essential businesses. On March the 22nd, WA and South Australia closed its borders to the rest of Australia. On March the 25th, the government forbids citizens from travelling overseas. In the previous views, we established key milestones taken by individual governments, all with the aim of protecting their citizens and the economy. Broadly speaking, all implemented a 4-step plan. Number 1, prepare for an outbreak. That's an increase in your ICU beds and increase in levels of PPE, masks, gloves and gowns. Public information, raising awareness. Potentially though the virus is already present, but it's just not being detected. The second phase is reduce. That's reduce exposure. Implement social distancing rules, reduce the size of gatherings, limited sports activities. Public venues can still open, but as long as they comply with the gatherings. People are advised against non-essential travel, and high-risk individuals are advised to stay at home. Third stage is restrict, and community transfer is more likely ongoing, and you've commenced testing. It's test, and conducting contact tracing. People are advised to stay at home in their bubble, work from home if they can, and physical distancing rules are enforced. Schools have limited openings, and there's further reduction in gatherings from 10 to 2 people. And in stage 4, you lock down your whole economy and population, and you close your borders. This is the 11th video. Generally, I use data from the World Health Organization, Johns Hopkins, and the Australian government because they are reliable. This video has been challenging to verify data from the UK and the UK home nations. So trying to gather historic data was not verifiable. All the data sets had a caveat that may not be correct. The UK reports only cases that have been tested in hospital settings or have passed away in a hospital. And as we know from earlier, the UK charities continue to challenge the UK that cases in nursing homes and care homes are not included in the government stats. All the other data from Australia, New Zealand, Republic of Ireland was easily obtained and on their government web pages. The next views will provide analysis on the spread of the COVID-19 virus. We've had to use 2 scales on the y-axis, and this is due to the large difference between the UK data and data from Australia and New Zealand. This view reports confirmed COVID cases in the UK, Republic of Ireland, New Zealand and Australia. The UK has 152,840 cases Republic of Ireland has 19,262 cases. New Zealand has 1,469 cases, and Australia 6,711 cases. This view discusses death attributed to COVID-19 in the UK, Republic of Ireland, New Zealand and Australia. And again, two scales have had to be used due to the large data difference between the UK and New Zealand and Australia. The UK has 20,732 deaths. Republic of Ireland has 1,087 deaths. New Zealand has 19 deaths, and Australia has 83 deaths. This next view breaks down the COVID confirmed cases into the UK home nations, Republic of Ireland, and Australian states and territories. Again, due to the large number of cases in England, two scales have had to be used. There is a clear difference between the Northern European countries and the Southern Hemisphere countries, states and territories. Australian states and territories and New Zealand have a fraction of the COVID-19 cases as opposed to the Republic of Ireland and the UK home nations. This next view again provides analysis of the deaths due to COVID-19 in the UK home nations, Republic of Ireland, New Zealand and Australian states and territories. Two scales have had to be used due to the number of deaths in England. Again, there is a clear difference between deaths in the UK home nations and the Republic of Ireland compared to New Zealand and Australian states and territories. This view provides information on the case fatality ratio comparisons for the UK, Republic of Ireland, New Zealand and Australia. The case fatality ratio, sometimes called the case fatality risk, is the proportion of deaths from a certain disease compared to the total number of people diagnosed with the disease. Case fatality ratio is conventionally expressed as a percentage and represents a measure of disease severity, and the example is given below. So we can see that United Kingdom has 13.6%, Republic of Ireland has 5.7%, Australia has 1.2%, and New Zealand also has 1.2%. This view provides a comparison of COVID-19 deaths per capita in the UK, Republic of Ireland, New Zealand and Australia. The deaths per capita mortality rate is the mortality rate from COVID-19 for a population. For example, in the United Kingdom in 2020, a total to date of 20,732 deaths occurred due to COVID-19. The estimated population for the UK is 55,900,000. So the mortality rate therefore was expressed at the 22,732 divided by the population and then multiplied by 100,000. This normalises the data across all population centres. Therefore, for these countries, 37 out of 100,000 is the mortality rate for the UK, 21.9 for Republic of Ireland, 0.32 for Australia, and 0.37 for New Zealand. I guess I would want to live in either New Zealand or Australia. This next view has the case fatality ratio comparisons for the UK home nations, Republic of Ireland, New Zealand and Australian states and territories. You can see there is a clear difference between the UK home nations and Republic of Ireland compared to the New Zealand and Australian states and territories. This view provides a comparison of COVID-19 deaths per capita in the UK home nations, Republic of Ireland, New Zealand and Australian states. As we can see, there is also a clear difference between fatalities per capita per 100,000 of the population in the Northern Hemisphere and those in the Southern Hemisphere. In summary, if you live in the UK or the Republic of Ireland, you have very much an increased potential of contracting COVID-19. If you live in the UK or the Republic of Ireland, you have an increased risk of dying from COVID-19. There's multiple explanations as to why this is. Population density, health systems being overwhelmed, governments slow to prepare for this outbreak. You can surmise that the UK government, similar to other Western Hemisphere countries, did not believe that they would be impacted to such a level that we see now. January and February was the period to prepare, build defences, increase stock levels of PPE, and test. The UK appeared to be in two minds how to approach, with members of the government, the scientific community, talking about implementing herd immunity. Herd immunity only works if you have a vaccine. The cost to the economy, the cost to individuals' lives are too expensive, right, to go for a natural herd immunity. And therefore, the UK in particular and the home nations are paying a heavy price, right, for the inactivity of the UK government between January and February. These next several views will give the current status of COVID-19 in Australia. Australia has been, to date, very successful in the management of the COVID-19, both from a federal government level and also from the states and territories governments. Australia has managed to flatten the curve. It has very low numbers of transmission, and the majority of cases are individuals arriving back into Australia via repatriation flights. The mortality rate is very low. So much so that some states have recently announced that they are going to be relaxing the rules so that individuals will be able to gather up to a maximum of 10 people. Some businesses can reopen, but we need to be very cautious and we need to take this slowly. If we look over at Singapore and we also look at Japan and some territories in China, there is a second wave. We need to ensure we don't have a second wave. So we need to take things very, very slowly. When we need to increase testing, test, so we can identify the levels of COVID-19 in the community. The government has recently released an app which can be loaded onto individuals' mobile telephones, and I'll talk about that in detail later. The Australian government deployed COVID Safe, which is a mobile phone app, and it's available on the App Store and also the Google Store. The app will assist the state health authorities in contact tracing. The app communicates via Bluetooth with other phones that have the app downloaded. The data does remain on your phone and it does not transmit to a third party. If an individual contracts COVID-19 and has the app, the health authority, with your permission, will download the data and identify telephone numbers that have been in close contact with the individual's mobile phone. That's within 1.5 metres over a period of 15 minutes. The health department will then contact the numbers, right, and advise the individual. Information is only stored for 21 days, and it is a criminal offence for a third party to access the data. This app allows Australia to verify the virus is not spreading silently in our community. I will urge everyone, please download this. And finally, we've done a great job here. I think the government's done a great job, the state and territories governments have done a great job, and we as Australians have done a fantastic job. We've done a great job, but now is not the time, right, to take our eye off the ball. Right? Just because we are relaxing some regulations, some rules, we can gather a little bit more, doesn't mean to say that we can go and party. We must maintain our social distancing. This is a very slow, step-by-step opening up of the economy, right? And if we do this, we will succeed. If we don't, and we don't follow the rules as they change, then the likelihood is that we will have a second wave. If we have a second wave, we go straight back into a lockdown situation. None of us want that. We all want to return back to some form of normality. Do remember, the only out for this is through the development of a vaccine. Look after yourself, look after your neighbours, look after your friends and family.